afternoon, everyone. I'm going to talk about the impact of screen time on ocular surface in children. We know that the daily media consumption has increased in today's pediatric age group, and the use of smartphones and tablets is a new normal, especially during the pandemic. So increased use often leads to a variety of SNOPIC symptoms. Pediatric population is generally more tolerant to these symptoms, so many of them go undiagnosed. So there is a strong need for a uniform protocol to screen for dry eye irrespective of the symptoms. So what we did in our study is we wanted to evaluate the impact of the electronic media use on the ocular surface health in children. So this was a cross-sectional study with purposive sampling. We included children who attended our OPD between September 2019 to October 2020 between the age group of 5 to 15 years who were using the appropriate spectacle correction. Children with congenital abnormalities of the eye, autoimmune diseases, prior surgery to the eye or trauma or severe allergy were excluded from the study. Appropriate statistical analysis was used. So we included 78 children in the study, and each parent was given a standardized questionnaire to answer, and a detailed slit lamp evaluation was done. Dry eye evaluation including OSDI scoring, Schirmer's test, T-BUT and fluorescent staining was done in all kids. This was a questionnaire that was given to the parent. So we had 78 children analyzed. The mean age group of was 11 years. 42% were females, 57% were males. So 45% of these children used smartphone and television. 19% used all three devices. 19% used smartphone only. 12% used smartphone and computer. 5% television. And there was no child that only used computer. So based on the screen time, we divided the group into less than 1 hour of smartphone as a control group and more than 1 hour of smartphone as a study group. In the control group, less than 3 hours of other media was control group 1, more than 3 hours of other media was control group 2. In the study group, less than 3 hours of other media was study group 1, more than 3 hours study group 2, and more than 4 hours of smartphone was study group 3. So based on this, in the control group 1, we had 21 children, control 2, we had 4, study 1, 41, study 2, 6, and study 3, 6 patients. So percentage of those with symptoms increased as the screen time increased. We had 70% who presented with headache, tearing, burning sensation, and headache was a predominant symptom. Coming to the OSDI scoring, the OSDI score was more than 12 in 57.7% of the population. And we see here that as the OSDI score increased when the screen time increased, and the p-value was significant. Coming to the Schirmer's test, the Schirmer's test also decreased as the amount of screen time increased, with a p-value of 0.06 in the right eye and 0.02 in the left eye. None of the subjects had a Schirmer's value of less than 10 seconds, but it showed a decreasing trend as the screen time increased. Coming to the tear breakup time, the tear breakup time also decreased as the screen time increased, and this was statistically significant across the study groups. Next, coming to the positive fluorescent staining test, this was noted in 7.7% of the population. However, this was not significant. But fluorescent staining was higher in those with more screen time. So comparing our study to other studies in the literature, the study done by Zhang et al., he compared adults, and he compared smartphone versus OSDI scoring, and he said that smartphone aggravated the OSDI score. Another study by Zhang et al., he evaluated children between the age group of 10 to 12 years, and it was a large sample size. He compared electronic media use with T-BUT and fluorescent staining. He also concluded that smartphone is an increased important risk in the dry eye in children. The third study by Katharina et al., she also compared children between the age group of 3 to 10 years, and she compared smartphone versus visual issues, and she concluded that asthenopic symptoms was higher in the video game group. The only study that contradicts our study was by Benjamin et al., but he did the study in adult population. So he compared the commonly used dry eye parameters like us using Schirmer's, T-BUT, OSDI and fluorescent staining, and he did not demonstrate any concordance between any of the signs or symptoms. So our study revealed that a significant portion of the study population had symptoms. The OSDI score showed a significant increase in those with very high smartphone use, and the T-BUT showed a decreasing trend as the screen time increased. While the fluorescent stain was not statistically significant, but it was higher in the group with the high media use. So while the results did not indicate a severe disease, but the OSDI and TBUT values showed a significant change as the duration of the screen time increased. In this generation of ever-increasing dependency on electronic media devices, both children and parents need to be aware of the ill effects. So studies like these compare the direct effects of screen time on ocular surface health in children become important. Our study had a smaller sample size and it was a limited duration of only 1 year, so that was the limitation of our study. So there is a need for a more holistic diagnostic policy that can diagnose dry eye before their apparent symptomatic manifestation. Thank you.
Yeah, thank you. Thank you for a nice presentation. And most of the times we see that children do have symptoms, though they may not have signs of dry eye.
Yes.
They definitely come with symptoms which are more with the increasing use of screen time.
You couldn't have found children who were not using these devices to compare, I think.
I don't think
every
there
child
was
is-
anybody who didn't use device because all of them were having online school during the time between October and September 2020. So most of them were using smartphones. And we didn't find any children who only use computer, which was surprising. Most of them had smartphone.
No, I'm saying you couldn't find children who were not using
No,
either of
we-
these.
no, we couldn't.
That is the main issue.
That was not there.
That is
Did the screen size affect the
So,
surface?
More than the screen size, I would say the distance between the screen and the viewing affects more because here the children with the smartphone had like more of dryness, decreasing Schirmer's, T-Butt and fluorescent staining. So it's not the size, but it is the distance.
It is blinking, I think. You blink less frequently, and that
Yes,
makes, I
yes.
think, a lot of difference.
Yes.
Tear film issues, I think, arise
Yes.
mainly because from blinking frequency goes down. I think
Yes.
that's the main thing. Thank you so much
Thank
for
you.
very interesting presentation.